of healthy red blood cells. When you go to the hospital, when your blood sample is taken, these are the values that you'll be told. For man, 14 grams per deciliter. When it's less than that one, you know that you are anemic. And for females, it's 12 grams per deciliter. So the red blood cells, iron is very important for the production of the red blood cells. So when the body does not have enough iron, it will make fewer red blood cells, or the red blood cells that do not that are very small. So that will cause iron deficiency anemia. Iron deficiency anemia could be as a result of inadequate diet. It could be as a result of inadequate diet could be you don't have enough of foods that contain iron has not been taken, or impaired absorption or gastric surgery. So increased iron loss, I highlighted the most important ones are hemorrhoids, or locally we call them piles, or peptic ulcer disease, in which the patient will bleeding, chronic bleeding, but the patient will not be aware of gross anemia. And for females, excessive menstrual flow and blood donation could be a cause of iron deficiency. Another very important cause of iron deficiency anemia is increased physiological requirements for iron. For instance, in infancy, when children are growing up, they need a lot of iron for growth. And pregnancy as well, because the pregnancy, the woman himself needs iron, and the unborn baby also needs iron. So therefore, the iron requirement is increased during that period. When the intake is low, it can lead to iron deficiency anemia. And lactation, it means, simple term means breastfeeding. When the lady is breastfeeding, the baby also is taking more iron from her. So therefore, the iron intake should increase, or else there will be iron deficiency anemia, and other causes now. So these are some of the symptoms. When you see, you can come to the hospital. When you see that you have fatigue, dizziness, headache, palpitation, that means you are aware of your heartbeat, or you have some difficulty breathing even after some simple activities, or lethargic, or your menstrual flow is increasing, or for if you see that your infants are not growing properly, then you can take them to the hospital for checkup. And because iron is deficient in the body, it can cause these symptoms. The person could be irritable, he could have a poor attention span, lack of interest in the surroundings, the poor work performance, there will be some behavioral disturbances, and the defective structure and function of some of the epithelial cells, like the hair, the skin, the nails, and the tongue. And the frequency of infection also will increase. And another very important symptom of iron deficiency is the pica. And another one is during pregnancy, because as you've seen earlier, during pregnancy you use a lot of iron for yourself and for the unborn baby. So it can cause premature birth. That's the baby will come before the normal time, or it can cause low birth weight, or even after delivery the woman can have a lot of infections. So therefore the mortality and the morbidity caused by iron deficiency will be very high. And some growth problems, because infants, they need a lot of iron for growth. But with all these complications, everything can be prevented. You have very simple measures that you can do to prevent iron deficiency anemia. And these foods that you can eat are locally available in the Gambia. For instance, liver, you have beans, dark green leafy vegetables, eggs, seafood, you have poultry, red meat, and for some people, pork as well can be eaten, and it can be a very good source of iron. But it's important to highlight that meat is the best source of iron, especially red meat and liver. They are very good sources of iron. As you see, the preventive measures are available in the Gambia, foods you can eat that you can prevent it. So I think it's better, we all know that prevention is better than cure, and then we can do all our best to eat the healthy foods to prevent the disease.
So I'm going to talk about high blood pressure, which we normally call hypertension. High blood pressure is a very important disease and is very common nowadays because of the lifestyle of the people. So before talking about high blood pressure, I will initially start definition of what blood pressure means. A blood pressure simply is defined as the pressure of the blood in the blood vessel. We all need a certain amount of pressure in our blood vessel in order for blood to flow easily. So what our heart normally does is it contracts and relaxes. By doing that, blood will pump through the blood vessel to different part of our body. So when the heart contracts, there are maximum pressure in the blood vessel that we call the systolic blood pressure. And when it relaxes, we have the lowest point of blood pressure in the blood vessel that we call the diastolic blood pressure. So when you go to your hospital or your doctor or your nurse, what he normally put into consideration is those two values. That's the highest pressure in your vessel and the lowest pressure in your vessel. So in that case, we now define what is high blood pressure, or in other words, what is hypertension. Hypertension is a condition in which when the blood pressure is constantly higher than the recommended level, that is when the pressure is more than 140 or 140 over 90 millimeter of mercury. So if you have high blood pressure, you have a risk of developing a lot of other problems. You can have problem in your heart that has, you can have heart attack. It can lead a problem in your brain, stroke, or you can have problem in other part of your body, like you can have problem in your kidney or your eyes. The causes of high blood pressure, about 90%, that's 9 out of every 10 people, is not known. However, there are certain risk factors that increases your chance of getting high blood pressure. So those risk factors are very important. So that's the most important thing I'm going to talk about. So some of those risk factors we call them modifiable risk factors that we can do something about. Unfortunately, there are some factors that are non-modifiable and we cannot do anything about them. So the modifiable risk factors are here mentioned. Smoking, either you smoke cigarette yourself or you are a second-hand smoker, you are at risk of developing high blood pressure. Not doing more exercise or you are physically inactive, you have a risk of developing high blood pressure. If you are overweight or you take too much salt in your diet or in your meal, or you drink too much alcohol, or not taking enough vegetable and fruits, or if you have too much stress, it can lead you to have high blood pressure. So what can we do to prevent high blood pressure? First, we need to avoid smoking, any form of smoking, whether you smoke cigarette directly or you are a second-hand smoker. It is believed that almost twice, those who smoke have almost twice risk of developing high blood pressure compared to those who does not smoke. So if you are a smoker, the single most important step you should do is to stop smoking in order to prevent yourself from developing high blood pressure. Two, you need to be physically active. That means you need to do exercise every now and then. There are different way of exercise, but the most recommended one are brisk walking, cycling, or swimming. So you need to do this at least 5 days in the 7 days a week. And each time you do it, it should be 30 minutes. You can do this 30 minutes one ago, or you do it 10 minutes after you relax. You do it another 10 minutes, but at least you must do it 5 days in a week and at least 30 minutes in once in a day. Thirdly, healthy weight is very important. So we need to reduce our weight, and if you are overweight, and if you are not overweight, you need to control yourself not to become overweight. So we need, in order to do that, we should avoid taking fatty foods, sugary foods, or sugary drinks. And the best way of losing weight is by reducing your calorie intake. Two, avoiding taking heavy foods before going to bed, or increasing your daily activity. If you take a lot of activities, then it will burn off your calories in your body and the fat. Fourth, we have to cut down salt intake. It's very important. Each adult is recommended to take at least not more than 6 grams of salt, which is just teaspoonful of salt. So if you imagine how much salt we normally take, it's more than that. So also we need to know what food we take, especially nowadays people go to supermarket, you buy any sort of food, which most of them contain a lot of salt. So, and most importantly also is we have to avoid taking salt to put salt in our already made food in our table is a very important risk factor to develop high blood pressure. We need to take a lot of vegetables and a lot of fruits because there are enough evidence that they help us to have healthy heart in other way, and also it helps us to reduce our blood pressure. So what we normally have to do is at least you take different kind of fruits, at least 5 different kind of fruits. It can even be the locally available fruits. They are very important because they contain a lot of vitamins and also a lot of minerals which are helpful to our heart. Also, we have to avoid taking alcohol. Alcohol is very dangerous to the heart because it destroys the heart muscles, and as a result, it can end up causing high blood pressure. And also, alcohol, they contain a lot of calories, so having a lot of calories in your diet increase your chance of becoming overweight, and as a result, you may develop high blood pressure. Stress directly can cause high blood pressure, but most importantly, the way we manage our stress. Some people, they are stressed, they engage in taking a lot of alcohol or they engage in smoking, so as a result, they become hypertensive. In conclusion, I would say high blood pressure is a very common condition and it can end up with death. So the cause is not known, but there are certain risk factors which are highly related to high blood pressure that I have just mentioned. It usually presents with no symptoms, so it is recommended that each and every one of us, especially those at all age, you do regular blood check at the nearby health center.